My name is Mahmoud. I'm the Chief of Vascular Endovascular Surgery at the University of California in San Diego. I can say unequivocally that this technology has been disruptive for us in improving the safety for our faculty, patients, and staff in the OR. The first thing we noticed that was there's a dramatic reduction in radiation exposure. And we were able to pull about 100 patients and compare the outcome before and after using the technology. And we saw at least about 2,000 milligray drop, 2-gray drop in radiation, which ended up being almost 50% reduction in the amount of radiation. And of course, this is important for the patient that they get the procedure, but that's their only radiation exposure. They're going to get more radiation exposure with the future CT scan follow-up. But for us doing these cases almost every day we're getting exposed to radiation, it's important. So I think it's just equally important to see the impact on the team in the operating room, and not just the vascular surgeon, the trainees, and also the entire staff in the room. Also significant reduction in the operative time and the amount of contrast. So there was about 80 cc reduction in the amount of contrast. As we adapted the technology and trusted it more and more and saw that its work, it allowed us to do a lot less digital subtraction angiography, which led to dramatic reduction in the contrast. And that's very important on two different aspects. One, when you're doing digital subtraction, that's the highest radiation exposure as opposed to regular fluoroscopy. Second is you're reducing the contrast, and a lot of our patients unfortunately have significant renal insufficiency. And you can look at some of the study, anywhere between 20 to 30% of vascular patients will have some sort of stage of renal dysfunction. It might not be stage 4, it could be stage 3 or 2. And with the added, CT follow-up that you have to do on these patients very routinely, right? You have to scan them 1 month, 6 months, 12 months, yearly after, all that cumulative doses of contrast that, constantly hitting the kidney and hurting the kidney. So I think, even though it doesn't sound like it's a lot, but I still think in my mind, about 80 cc reduction in contrast every case is significant. The other thing is the timing. So, being efficient and being able to get into these vessels very quickly, with the guidance of SIDAR, it allows us to cut our operative time, and we saw about 30-minute reduction in each case. The data need to be out there and need to be peer-reviewed and need to be published to kind of show people that yes, this is real, this is not just a fluke, and then there is reduction in radiation, there is an improvement in the safety, there's more efficiency, less time in the OR, less contrast. So I think as people see this more and more, they're going to adopt this technology, and I think the benefit will be spread hopefully to many patients, as many as possible.